Welcome back. Today we are focusing on what to say at the doctor's office in English to explain your symptoms clearly. Because honestly, even for native speakers, describing exactly how you feel can be a bit of a challenge when you are sitting on that crinkly paper on the exam table.
You are going to learn how to move past just saying "I feel sick" and start using specific words for different kinds of pain, how to describe when your symptoms started, and even how to handle those follow-up questions the nurses always ask before the doctor even walks in.
I always get so nervous that I'll forget half of what's wrong the second the doctor looks at me with that clipboard.
That happens to everyone, which is why having a few go-to phrases in your back pocket makes the whole experience way less stressful.
Exactly. Like instead of just saying my head hurts, you might say I have a throbbing headache or a dull ache.
Or, if you've been feeling under the weather, you could mention if it's a constant thing or if it just comes and goes throughout the afternoon.
I think the most important part is being honest about how much it's actually affecting your daily routine at home or work.
Right, because the doctor needs to know if you can't sleep or if you're just feeling a bit tired during your morning coffee.
Let's dive into some common scenarios you might find yourself in, starting right at the front desk where everything begins.
It usually starts with checking in and then waiting for that moment they call your name to head back to the vital station.
Once you're back there, the nurse is the first person who is going to ask you what brings you in today.
That's your first big opportunity to be clear. So practicing a simple summary of your main issue is really helpful.
For example, you could say, I've been having some sharp pains in my lower back for about 3 days now.
That's perfect because it gives them a location, a description of the pain, and a timeline all in one short sentence.
I've also noticed people struggle with describing things like dizziness versus just feeling a bit lightheaded after standing up too fast.
Distinguishing between those two can actually help the doctor narrow down what might be going on much faster than a general description.
And don't even get me started on stomach issues, where people often just say my stomach is upset without saying if it's cramps or bloating.
Those are very different feelings, and using those specific words helps everyone get on the same page during the appointment.
When we talk about pain specifically, it is so helpful to have a variety of adjectives ready because it hurts is just the starting point of the conversation. You might describe something as a sharp pain, which feels like a needle or a knife. Or perhaps it is a dull pain that is more of a constant low-level annoyance that you can ignore but still feel in the background. Then there is throbbing pain, which follows the rhythm of your heartbeat, often associated with headaches or infections that have a lot of pressure behind them. Another one I use a lot is stinging, which is more on the surface of the skin, like a bee sting or a scrape that is healing. If you can tell your doctor it's a stinging sensation rather than a deep ache, they can immediately rule out internal issues versus skin-level irritation. It really adds a layer of professionalism to your side of the conversation, even if the situation feels a bit vulnerable or scary while you are waiting for a diagnosis. I always try to think about if the pain is traveling or radiating to other parts of my body, because that is a key piece of information for any medical professional. For instance, if your shoulder hurts, but the pain is radiating down your arm, that is a much different situation than just a sore muscle from lifting something heavy. Practice saying these words out loud at home so they feel natural when you are actually in the room and the pressure is on to speak clearly.
I think a lot of people also worry about the social aspect of the doctor's office, like how to politely interrupt if you don't understand a term they just used. A very natural way to do this is to say, "I'm sorry, could you put that in layman's terms for me?" Or, "I'm not quite following what that means for my daily life." Doctors are used to this, and they actually appreciate when patients are engaged enough to ask for clarification, instead of just nodding along while feeling confused. You can also ask about side effects of any new medication by saying, "Is this going to make me drowsy or affect my appetite at all?" It's your body and your life, so using these casual phrases to get the information you need is perfectly acceptable and even encouraged in most modern clinics. Another thing to consider is how you describe your medical history. If they ask about things that have happened to you in the past or to your family members, you don't need to know every single Latin name for every condition, as long as you can describe the general idea of what happened to your relatives. Saying, "My grandfather had some heart issues in his 50s," is usually enough to give the doctor a heads up to look into specific risk factors for your own health. It's all about creating a conversation where you feel like a partner in your care, rather than just someone who is being examined like a biology project.
Let's imagine you're talking to a friend about a cold that just won't quit, and they suggest you head to the walk-in clinic to get checked out before the weekend. You walk in and tell them that you've been congested for a week, and that you have a scratchy throat that makes it difficult to swallow your morning tea or even just water. Using scratchy is much more descriptive than just saying sore, because it implies that dry, itchy feeling that often comes before a full-blown infection starts to take hold. You might also mention that you've been running a fever off and on, which sounds much more natural than saying, "My body temperature is high," in a casual conversation. Doctors also want to know if your cough is productive, which is a fancy way of asking if you are coughing anything up, or if it is just a dry cough that tickles your chest. If you can say, "I have a dry, hacking cough that gets worse at night," you are giving them almost everything they need to start helping you out. It is these little details that make the difference between a quick, efficient visit and a long, drawn-out process of trial and error with different medications. Another great phrase is "short of breath," which is much more common than saying "respiratory difficulty" when you're describing how you feel after walking up a flight of stairs. People also use the term "fatigued" to describe a level of tiredness that sleep just doesn't seem to fix, no matter how many hours you spend in bed.
When you're at the pharmacy picking up your prescription, you can use similar casual English to make sure you're taking the medicine correctly and safely. You might ask, should I take this on an empty stomach or with a meal? Or, is it okay to have a glass of wine while I'm on this round of antibiotics? These are very common questions, and the pharmacist is there to answer them in a way that is easy for you to understand, without a lot of jargon. You can also ask for the generic version of a drug if you want to save some money, which is a very common and smart thing to do in many healthcare systems. Just say, is there a generic equivalent for this that might be a bit more affordable for me right now? And they will check their system for you immediately. If you're feeling a bit loopy or spacey after taking a new pill, that's another great set of words to describe that slightly disoriented feeling that isn't quite dizziness. You can call the office and tell them, I started the new meds yesterday and I'm feeling a bit out of it, and they will know what you mean. It's much more evocative than just saying, I feel weird, because out of it specifically describes a lack of focus or a foggy brain feeling. All of these phrases work together to give a full picture of your experience, so the professionals can make the best decisions for your recovery.
Sometimes, the doctor will ask if you have any accompanying symptoms, which just means other things happening at the same time as your main problem. You might say that along with your headache, you've been feeling a bit nauseous, or that your vision has been blurry when you look at bright lights or computer screens. If you feel lightheaded, it means you feel like you might faint, whereas vertigo or dizziness often feels like the entire room is spinning around you, even when you're sitting perfectly still. These distinctions might seem small, but they change the entire direction of a medical exam and the tests they might decide to run on you that day. I also find it helpful to describe tenderness, which is when a spot doesn't hurt until someone actually touches it or presses down on the skin. You can say it's tender to the touch right here, while pointing to the specific area that is bothering you so the doctor can feel for swelling or inflammation. Don't be afraid to use your hands to show where the pain starts and where it ends, because visual cues are just as important as the words you are using. If you have a rash, describe if it is itchy or flaky, or if it feels hot to the touch, because those details indicate different types of skin reactions or infections. The more you can narrow it down with these natural English descriptors, the more confident you will feel standing up for your own health needs and concerns.
Let's talk about the waiting game, which is something we all experience when we're trying to get an appointment or waiting for test results to come back from the lab. You might call the office and say, I'm just checking in to see if my blood work results have cleared yet, or I wanted to follow up on the referral you sent over. Using checking in and following up are very polite and natural ways to stay on top of your healthcare without sounding like you are complaining or being impatient. If you need to reschedule an appointment, just say, something came up and I won't be able to make it in today. Could we push this back to next week? Most offices are very understanding of unforeseen circumstances, as long as you give them a call as soon as you know your plans have changed for the day. If you're in the waiting room and it's taking a long time, you can ask the receptionist, is the doctor running behind today? Which is a very standard way to check on the status. It lets them know you're still there and gives them a chance to apologize and give you a more accurate estimate of when you'll be seen. These interactions might feel small, but they build a rapport with the staff that can make your future visits go much more smoothly and pleasantly.
Let's try a quick practice round together, where I describe a situation and you think about how you would explain it to a professional in a casual but clear way. Imagine you woke up with a stiff neck and it's making it hard to turn your head while you are driving your car to work in the morning. You could say, "I woke up with a real kink in my neck and now it's so stiff that I can't check my blind spots without reaching around with my whole body." That word kink is very common in everyday English to describe a sudden muscle cramp or stiffness that happens after sleeping in an awkward position on your pillow. Or maybe you've been feeling run down lately, which is a wonderful casual expression that means you feel like you're about to get sick because you're overworked or stressed out. Telling a doctor, "I've just been feeling really run down and low on energy for the last 2 weeks," gives them a great overview of your general well-being. It's much better than just saying, "I'm tired," because run down implies a physiological state of being vulnerable to illness or exhaustion that needs to be addressed. We also use the word flare-up when a chronic condition like allergies or a skin issue suddenly gets much worse after being quiet for a long period of time. You can say, "My seasonal allergies are having a major flare-up because of all the pollen in the air this week," and everyone will know exactly what you mean.
Sometimes you have to describe a sharp versus a throbbing sensation, which we mentioned earlier. But also, think about cramping in different parts of your body. If you've been doing a lot of hiking or walking, you might get a Charlie horse in your leg, which is a very common American English term for a sudden painful muscle spasm. You can tell your doctor, "I've been getting these awful Charlie horses in my calves in the middle of the night, and they're waking me up." It's such a specific term that they will immediately know you need more hydration or maybe some magnesium in your diet to help your muscles relax. Or if you have a crick in your back, it means a small nagging pain that makes it hard to stand up straight or bend over to tie your shoes. "I've got a real crick in my lower back" sounds much more like a native speaker than saying, "I have a minor spinal muscular blockage," or something overly technical. We also use sore for that healthy kind of pain you get after a good workout, while aching usually implies something a bit more systemic or related to being sick. If you have the chills, it means you're shivering even if the room is warm, which is almost always a sign that a fever is either starting or breaking. Telling the doctor, "I had the chills all night and I couldn't get warm no matter how many blankets I used," is a classic symptom description.
Another area where people often get stuck is describing numbness or that pins and needles feeling you get when your foot falls asleep after sitting too long. In a medical context, you can tell the doctor, "I'm getting a tingling sensation in my fingertips," and they will immediately understand that it's a nerve-related issue rather than a muscle problem. It is also important to talk about the severity of the pain on a scale of 1 to 10, even though that feels a bit arbitrary and difficult to pin down sometimes. You can say, "At its worst, it's a solid 7, but most of the time it lingers around a 3 or a 4 while I'm just sitting at my desk." Using lingers is a great way to describe a pain that doesn't go away completely, but stays at a manageable level throughout the day or night. If the pain comes in waves, it means it gets really intense for a few minutes and then fades away before coming back again later on in the hour. This is very common with things like stomach cramps or even certain types of back issues where movement triggers the discomfort in a rhythmic way. Make sure to mention if any over-the-counter medicine like aspirin or ibuprofen has made a difference in how you are feeling since the symptoms first started appearing. Telling them, "I took some Tylenol, but it didn't even touch the pain," lets the doctor know that whatever is going on is fairly significant and needs a stronger approach.
I also want to touch on how to describe things that are tender, which is different from being sore, because it only hurts when pressure is applied to the area. For example, if you have a bruised arm, it might not hurt while you're sitting there, but it is tender to the touch when your sleeve rubs against it. This is a very helpful distinction for doctors when they're trying to figure out if an injury is internal or just on the surface of your skin or muscles. You can also mention if a pain is localized in one spot, or if it feels like it's all over your whole body, like when you have the flu and everything just feels heavy and tired. "I'm just achy all over" is a very common way to describe that feeling of general malaise that comes with a virus or a bad cold. If you have a clogged ear or stuffy nose, those are much better words than nasal congestion or auditory blockage when you are just talking to the nurse during check-in. They want the raw, honest description of your physical experience so they can translate it into medical terms for your chart and for the doctor's review. Being afraid to use simple words is a mistake, because those simple words are often the most accurate representation of what you are actually feeling in the moment.
One more thing I always suggest is bringing a cheat sheet with you if you're worried about forgetting your symptoms once you get into the room. It's not cheating at all to have a little list on your phone or a piece of paper that says, "Started Tuesday, sharp pain, worse after eating." In fact, most doctors love it because it makes the whole process faster and ensures that they don't miss any critical information that might change your treatment plan. You can just say, "I actually jotted down a few notes so I wouldn't forget anything today," and start reading from your list. It shows that you're taking your health seriously and that you respect the doctor's time as well as your own. It also helps if you're feeling a bit foggy due to being sick, because your memory isn't always at its best when you have a high fever or haven't slept well. Don't feel embarrassed about it at all. It's a very common practice among people who have to manage multiple health issues or just busy lives. Every time I do this, the nurse usually smiles and says, "Oh, I wish everyone did that," because it makes their job so much easier when it comes to data entry. It's a win-win for everyone involved in the medical encounter and leads to much better health outcomes in the long run.
That's a fantastic point about doctors being people too. And I think using natural English helps to lower the barrier of formality that often makes people feel intimidated in medical settings. If you feel like you're being rushed, don't be afraid to say, "Just a second, I have one more question before you go," to make sure you get the attention you deserve. You're paying for their time and expertise. And part of that service is making sure you feel heard and understood throughout the entire process. As they suggest a procedure and you're nervous, you can say, "I'm a bit anxious about this. Could you walk me through exactly what's going to happen?" Knowing the play-by-play of a test or a small surgery can take a lot of the fear out of the situation and help you stay calm while it's being performed. You can also mention if you have any allergies to specific things like latex or certain adhesives like medical tape, as that's a very important safety detail. Just say, "I always break out in a rash if I use regular Band-Aids," and they will use a different type of bandage for you. It's all about these small self-advocacy moments that ensure you have a comfortable and safe experience from start to finish at the clinic.
I hope you found this breakdown really helpful and that you feel more prepared for your next appointment. And definitely remember to take a deep breath and stay calm as you speak. If you enjoyed this lesson and want more natural English tips for your daily life, make sure to like the video and subscribe so you never miss another episode from us. Thanks for hanging out with us today and for taking your English skills to the next level by focusing on such a practical and important topic for your well-being. We'll catch you in the next one where we'll dive into another real-world scenario to help you speak with confidence and ease. Goodbye for now, and stay healthy, everyone out there.